I'm Don Evenson, and I guess I'm known as the father of the concept of sperm DNA fragmentation, which I started many years ago and was at Sloan Kettering Cancer Center in New York, where I was challenged with the question of, is it possible to measure DNA damage in sperm of guys undergoing chemotherapy? Because that's a major concern, because chemotherapy agents break DNA. It's a very successful project, and that's jumping. I am. And but the same protocol we developed then has become very useful for infertility and male factor infertility with broken DNA in their sperm. I started this way back in 1980 and spent many years in research to verify that in fact what we were measuring was a factor for fertility. We've done like more than 100,000 samples from animals and so forth that can control fertility issues. And now we commercialized in 2003, and we've now done many thousands of samples, and we have laboratories around the world, in Europe and South America, and other places in Australia, where it's our test is considered sort of the gold standard of this sperm DNA fragmentation concept. Next slide. So, with regard to age and the father conception and outcome for pregnancy, we first did a test with the Lawrence Livermore Laboratory in California, where 100 men who were sperm donors, not infertile or fertile, just men who were healthy, had no urological issues, and we asked simply the question, what changes occur in sperm with age of man? Next slide. Here you see that the on the left is the DNA fragmentation index. That means the percentage of sperm in the semen sample that have broken DNA. On the bottom there's the age of the donor. We go from age 22 up to 80. And with regard to men, it's very heterogeneous. For women, the window is pretty tight at about 40 years of age or so. But for men, you have people known to have kids when they're 60s and 70s. But note that the between 20 and 40, most of these samples are below that threshold line of 25%. And those above 45, most of those are above that. However, you can see that a young man in the, say, 35 may have excellent sperm, and a man who's, in this case, like 55, has excellent also. So it's a variable type of thing from genetics and a variety of factors. But the trend is up so that the average age of reaching that threshold is about age 45. Next slide. There it is in the block form, seeing that the sperm DNA fragmentation goes up significantly with age. Next slide. We just recently took the last 3,000 patients we've analyzed in our lab and simply asked the question from the medical report, what's the age of the man and what's his level of DNA fragmentation in the sperm? Again, we found that in the it's pretty flat until you get up to about 45, and there's a significant increase in the level of fragmentation with time, with age. Next slide. There's a study that came out a few months ago from Sweden, which has gotten a lot of attention with regard to the age of the father at conception and psychiatric disorders of the offspring. This was done in Sweden, where they keep track of all the births and all of the health records of the child. And this was done on 2.6 million children. Next slide. And so these kids were followed with psychiatrists and so forth, asking what sort of psychic disorders there might be with that child, and then correlating that with the age of the father at which the child was conceived. They found that comparing the 20 to 24-year-old men with those who were 45 years and older had a heightened risk of autism, a heightened risk of times 3.45, attention deficit hyperactivity disorder 13.3, psychosis 2, bipolar disorder 24, suicide attempts 2.7, substance use problems 2.4, failing to grade 1.5, and low educational attainment 1.7. Next slide. The paper, the authors concluded that the rationale or the cause of this psychic disorders with age of man was due to new genetic mutations that occurred during spermatogenesis. They're causally related to offspring morbidity. We would say we would substitute mutations or add to it. That's not just mutations, but DNA strand breaks, as we saw in our two previous studies on our patients and the men from Lawrence Livermore. Next slide. So the conclusions we have for our assay is that our SCSA, which stands for Sperm Chromatin Structure Assay, it measures DNA strand breaks. Sperm DNA fragmentation is caused by numerous factors such as environmental toxins, disease, genetics, and the aging process. When that value is above 25%, the pregnancy success rate is increased by using intracytoplasmic sperm injection. There's a variety of reasons for that, but once you get to about a value of 50%, we advise the father that probably his sperm should not be used because of severe problems with DNA damage. Sperm DNA fragmentation may be reduced by lifestyle changes, dietary like antioxidants, medical interventions, for example, varicose repair. DNA fragmentation testing is a valid, proven, useful procedure for infertility clinics and is predictive of male factor infertility beyond the classical semen test. Next slide. So our conclusions between age and the percent DFI studies of our studies and those the Swedish report that just came out is that sperm DNA fragmentation that becomes significantly elevated after age 40 is consistent with a significantly elevated psychic birth defects after 40 years of age by the father. Next slide. So we can ask the question, who should have a sperm DNA fragmentation test? The greatest use has been, for example, idiopathic infertile couples, where the men's semen analysis seems okay by the standard routine classical test, which isn't very useful sometimes, and the woman seems okay, but there's not any pregnancy, and this we have found that in many cases that the man has sperm DNA fragmentation. A study we did in Canada, there were 13 couples that had high levels of DNA fragmentation, idiopathic infertile. They used a sperm donor, and 11 of 13 couples were pregnant within 3 months, suggesting strongly that it was a DNA fragmentation in those husbands' sperm that was the cause of the infertility problem. We say older men, even if there was a prior fertility, even though you have kids at 20, it does not mean that you have been able to have kids at an older age, because time has taken its toll on the integrity of the DNA. Men with known exposure to toxicants, abnormal semen quality, a varicocele, that's the enlarged vein in the testis, so the sperm developing sperm are too warm, and does not make for good sperm. Couples considering assisted reproductive technology, for example, in Sweden, in southern Sweden, there's a health law where a couple comes in for infertility. Usually they use IUI first, but the government requires that they do this SCSA test first, and if the value is above 25%, they would normally offer 5 free IUI procedures, but they found that since it's not likely to have a pregnancy, it's cost effective to go straight to ICSI. And there's some clinics that send all their couples samples to us because simply as a means to, might say, almost catch, you might say, the sample that should have been okay, but turns out not to be okay by our test. Next slide. There's our little office in South Dakota, and we have snow there. A snowstorm there was yesterday.